Hello everyone, I am Dr Anjali Kumar. I am a gynecologist and obstetrician. I am the Director of Department of Gynaecology and Obstetrics at CK Birla Hospital, Gurgaon. So today I am going to be talking to you about a topic which is very common and which every pregnant mother wants to discuss with her doctor. So yes, you guessed it right, whether my delivery is going to be a normal delivery or it is going to be a cesarean delivery. So let's first talk about what is a cesarean delivery. So a cesarean delivery, or as we medically call it as lower segment cesarean section, is a delivery in which the baby comes out through the abdominal wall instead of coming out through a normal vaginal route. Now there are two main important reasons for doing a cesarean section. Now one is known as a planned cesarean section, medically it is called as elective cesarean section, and the second reason is a emergency cesarean section. So elective cesarean section means that the cesarean section has been planned well before a woman has gone into labor. Now this could be because of a variety of reasons. Either the baby's size is very big, or the mother's pelvis, which means the passage through which the baby's head is going to come out, that is very narrow. Medically we call it as cephalopelvic disproportion, which means probably there is some kind of disproportion between the maternal passage and the baby's head. So number one is CPD, cephalopelvic disproportion. Second reason of an elective cesarean section could be that the baby's position is either breech or transverse or maybe some other position. In a normal case, the baby comes out head first. But in case the baby is in a breech position, which means that the baby's head is up and the feet or the buttocks are down below, probably your doctor may decide for a cesarean section. Or sometimes the baby, instead of being in a vertical position, it is in a transverse position. So that's also a position wherein the doctor may take a decision for an elective cesarean section. Then the second important reason of an elective cesarean section could be what is known as a low placenta. Now placenta is an organ which basically connects the mother to the baby, and in a normal case it is located at the top of the uterus. But in case the placenta is low lying, these are the mothers who are at a very high risk of having a high bleeding during a normal delivery. So we generally opt for a planned cesarean section in such cases. Then the other reasons of a elective or the planned cesarean section could be in case the woman has undergone more than 2 previous cesarean sections in the past, or the woman is suffering probably from a herpes infection or an HIV infection, and we are worried that if the baby comes out through the vaginal route, the baby may acquire the infection. Then let's talk about the emergency cesarean section. Now emergency cesarean section means that the decision for the cesarean section has been taken during labor. So in case during labor the baby's heartbeat starts coming down, or the baby passes motion inside, or despite good labor pains the baby is not able to descend into the pelvis, or it's a prolonged labor, then also we have to take a decision for the emergency cesarean section. Many times these days we are also getting social indications for a cesarean section, which means there are so many people who actually come with a request like, ma'am, I want a cesarean section on a particular date, or sometimes because of the fear of the pain, women are not really wanting to go into the vaginal birth. So now let's talk about what is better, whether a vaginal delivery is better or a cesarean section is better. Now I always tell to all my patients, anything which is normal is obviously better than anything which is not so normal. I would not say that the cesarean section is abnormal, obviously not. In case your doctor decides for a cesarean section, it is better to have a cesarean section rather than having a compromised baby or a compromised mother. But in case everything is going on normally, I think you should really try to go in for a vaginal birth. So why is vaginal birth better than a cesarean section? Medically, it is said that the blood loss is more in case of a cesarean section delivery. The chances of infection are higher in case of a cesarean delivery. Chances of anesthetic complications are also higher in case a woman goes for a cesarean delivery. Also, the chances of a future cesarean section in the future pregnancy also becomes much higher in case of a cesarean section. Also, vaginal birth is supposed to be better for the baby as well. So when the baby is coming through the tight vaginal passage, it is said that the baby's lungs, they get squeezed during the passage from the vaginal birth. So any fluid which is present in the baby's lungs also gets squeezed out, and the chances of baby having a breathing difficulty immediately post-delivery are much lesser in case of a normal delivery as compared to cesarean section delivery. Also, when the baby is delivered vaginally, the baby tends to acquire good bacteria from the mother's vaginal canal, which helps in the baby's gut and prevents the infection later on in the baby. So yes, in the end, I would want to say that vaginal delivery definitely is better than a cesarean section, but you must decide this in consultation with your doctor as to what kind of delivery is better or safer for you. The doctor is going to take into account your detailed history, your so-called risk factors into account, your personal choices. These days we say that a woman has a right to make an informed choice as to what kind of delivery she wants. Then another common question which most of the times patients ask their doctor is, ma'am, is there anything I can do to have normal delivery? So yes, a lot can be done at your end. Number one, be very, very active. Now being active will ensure that you gain the optimum amount of weight gain. Women who are active will also have babies who are not too big. Women who are active will have less chances of high blood pressure and gestational diabetes also in pregnancy. Then another thing which you can do is to eat healthy in pregnancy so that you gain the optimum amount of weight in pregnancy. Go for regular checkups. Talk to your doctor about the kind of pain relief we can give you in pregnancy. So these days there are a lot of things which can be done to tackle the pain of labor. We have things like Entonox, we have epidural analgesia. So please talk to the doctor and see if you would like to avail those pain relieving options. We have a lot of antenatal classes, Lamaze classes and yoga classes, and all these classes, they help in preparing the women or the couples for the normal vaginal birth. So make sure you avail all these options, talk to the doctor about the availability of all these facilities in your hospital. And finally, I would say that you have to trust your doctor. So whatever decision your doctor has taken for you, it is to make sure that you and your baby are safe and healthy. So wishing you a very, very safe delivery and a very joyous motherhood. Thank you.